Hi guys, I'm Dr. Misbah. I will discuss with you about some tricks to memorize or understand the difference between the connective tissue fibers. There are three types of connective tissue fibers you know. That is the collagen fibers, reticular fibers, and elastin fibers. And the most confusing things are the branching of these fibers and the length of these fibers, because it is very much difficult, as it is similar with the three fibers, such as which fibers are length is long, which is short, which fibers are branched, which fibers are unbranched. So there is a tricks I will show you to the. Okay, hemp tissue fibers will you should only memorize some three words. There is the LUC, luck, BEL, bell, and RBS হচ্ছে RBS there are the three words only you should memorize, and then you will memorize a lot of things by learning only the three words. LUC, in this word there is a C, that means it is for collagen fibers. BEL, there is an E in this word, so it is for elastic fiber. RBS, there is R in this word, so it is for reticular fibers. RBS, that means branched and short. BEL means branched and long. LUC means long and unbranched. That means collagen fibers long and unbranched, and elastic fiber branched and long, and reticular fiber is branched and short. It is so much easy by only learning these three words. And you should also, I have noticed that there is similarity between the reticular fiber and the elastic fiber. And the collagen fiber somehow different between, among the three connective tissue fibers. Collagen fibers are soft. Collagen fibers are transparent. Collagen fibers are less elastic. True collagen fibers consistency is soft. It is flexible. It is tensile strength is high. Extensibility relatively inextensible. As we should know that the distribution of these three connective tissue fibers, which fibers are in contained in which type of tissue, such as that in connective tissue such as collagen fiber, which are distributed in the joint, capsule, ligament, tendon. In such cases, it should be tendons are usually transparent, relatively inextensible, and flexibility is less. It is flexible. In joint, as it is abundant in joint, so it should be flexible to move the joint, and it is transparent, and it is converted into gelatin when it is boiled. It is in pepsin digestion is rapid. Dilution with acid and alkali occur. But in other fibers, such as reticular fibers, they are resistant. And elastic fibers, they are resistant to boiling, they are resistant to pepsin, they are resistant to acid or alkali. Only there is an exception with reticular fibers, which in pepsin digestion it is slow to resistant. But there is a fair difference in collagen fibers, which is different with those of these reticular fibers and elastic fibers. So I should say that the distribution of these fibers, such as collagen fibers, are found in tendon, joint, capsule, ligaments. Reticular fibers found in smooth muscle endothelium, and framework of hematopoietic organs such as spleen, which organs are involved in hemopoiesis. Those are the distribution of reticular fibers such as spleen, lymph nodes, red bone marrow. And in elastic fibers, which organs need some elasticity, such as lungs, vocal cord, ligamentum flava, ligamentum nushi, and blood vessels such as aorta. They need some elasticity to properly work their function. So elastic fibers are relatively extensible, and reticular fiber also relatively extensible, but The collagen fibers are relatively uh, inextensible and relatively inelastic, but other fibers are relatively extensible and relatively elastic. Other fibers are hard, but the collagen fibers distribution is soft. So I have present to you the three new words like bell, RBS, by which you easily differentiate the three fibers, connective tissue fibers. Okay, thank you. See you next time.